उसको ले जाओ बाहर, मेरी एग्जैक्ट 9 बज गए हैं, 10 बजे तक। So guys, good morning to all of you. I welcome you to the class of medicine. Today we are going to discuss about must-know topics of medicine which are expected to be asked in your foreign medical graduate exit examination or screening examination. Right? So guys, good morning to all of you. Just a second, let me set with all this audio video things. Guys, in the chat box, I request all of you to please confirm me about the audio video thing, about the technology part. Is everything okay? So that we can start our discussion for today. Thank you, dopamine. Thank you, everyone. Okay. So, guys, the point which I am going to start is see, we will have this session, 1 hour session, where I am going to just discuss, or let's say I am going to recall what we have discussed in the previous classes, right? So, the topics which we will be discussing of important topics, and from that the important point of that particular topic, which is going to help you to approach to a question, right? So, we will be going to start with the first very important topic, that is neurology, right? In neurology, my dear friend, the important topic is, first of all, there are two important topics which have been always asked. One, it is which one? Seizures. One, it is seizure. Second one is stroke, and third one is meningitis. So these are the two or three. In fact, I just earlier said two, but I think meningitis is the important topic. Why seizure is it is an important topic? Do remember this thing. Seizure is being asked in pediatrics, so being asked in medicine, it is being asked in pharmacology. So three different subjects, one single topic. Stroke, although it can be asked in medicine from surgical point of view, because hemorrhagic strokes, what needs to be the management or the treatment, it is also asked. The treatment part is very important. Coming to meningitis, it is very important from medicine point of view, from pediatrics point of view, from microbiology point of view, because so many organisms, they can cause meningitis depending upon the age group, and from pharmacology point of view. So four different subjects and a single topic, guys, right? Okay. So let's start with the very first topic we are going to discuss is about the seizures. So I'm just going to discuss about the important aspects of the seizures. We know what does a seizure means. These are the paroxysmal. Do remember this thing. I'm just going to explain you. I'm just going to write the important points over here on the board. So these are the paroxysmal but transient events of excess and hypersynchronous discharges from the brain. Another term is called as epilepsy. What is epilepsy, guys? Epilepsy, do remember when a patient have multiple episodes of seizures. Now, causes are very important. Causes are very important. If they ask you the causes in a neonate, can you please tell me what is the cause of a seizure in a neonate? One liner, or they can frame out a question, cause of a seizure in a neonate. Hanji, can you please tell me what is the cause of seizure in a neonate? So the cause of seizure first is what you call it as, it is perinatal hypoxia. It is perinatal hypoxia. Perinatal hypoxia or ischemia you can call, or ischemia. It can be an intracranial hemorrhage. Intracranial hemorrhage, I'm just HMD means hemorrhage, right? It can be a CNS infection. It can be a CNS infection. Then there can be a metabolic cause also. There can be a metabolic cause. Now, what are the metabolic causes, guys? The important thing I am writing in red. First of all, it can be due to hypoglycemia. It can be due to hypoglycemia or hypocalcemia. So do understand this thing, hypoglycemia and hypocalcemia, these are the two important causes. These are the two important causes, provided they are asking a cause of seizure in the neonates, or they may put you a history of a child presenting after birth, patient is having tonic-clonic movements or patient is having frothing, anything clinical history they can present, and they can ask you directly one question, that which among the following is the cause, right? Okay ji. Now let's lead to the next slide. Second comes infant and children. Second is infant and children. So guys, what are the likely causes of infant and children's? Yes, here patient is having, first, the most important and the most common cause is febrile seizures. Most important and the most common is febrile seizure. Then, my dear friend, after febrile seizure, it can be due to some genetic disorder. It can be due to some genetic disorder, right? It can be due to some CNS infections. Third thing is trauma. So these are some of the important causes of seizures in infant and children. The third important category is adolescents now. Adolescents, right? Now age between somewhere 12 to 18 years, right? Or we can say the teenagers particularly. So what are the causes? So in this, trauma comes the most common cause. Trauma comes the most important and the most common cause. After trauma, patient can present. Then is infections, right? Then the third one is drug abuse. Drug abuse. So these are the causes. Coming to the fourth list is young adults. Young adults. And in young adults, my dear friend, what are the causes? Again, my dear friend, the trauma is going to be the important cause. Trauma is going to be the important cause. After trauma, alcohol, drug abuse, drug abuse, brain tumors, or autoantibodies. Autoantibodies. So these are some of the important causes, right? So quickly revise what we have done. They may ask you in the first thing, this one, do remember perinatal hypoxia and ischemia. What general we mistake? We get confused with this febrile seizure. Do remember febrile seizures are in infants and in children. Whereas if the age group is only less than 28 days, do remember perinatal hypoxia and ischemia are going to be the most common causes. Else, if there is a history of low blood sugars, hypoglycemia, or somewhere hypocalcemia, you find that in the MCQ it is written like this thing, then do remember this thing, that this can be the cause, right? Okay. Then adolescents, trauma is the most common cause. Young adult trauma and alcohol, auto antibodies, this is also an important cause. So you have to remember all these things. And the fifth category which we have is what, beta? The fifth category we do have is older adults. Older adults, right? More than 35 years. Older adults means more than 35-year age. Here CVA comes the most common cause. Cerebrovascular accident comes the most common cause. Then some brain tumors. Brain tumors, beta. Right? Alcohol withdrawal. Alcohol withdrawal. Metabolic disorders. Metabolic disorders, right? Now what metabolic disorders? Like patient can have uremia, hepatic failure, then apart from this, autoantibodies. Auto AB means autoantibodies, right? Alzheimer's. Alzheimer's generally after the age of 60 years, more than 60 years, particularly if they ask you these things, right? So these are the causes in adults. Now another important question is the drugs. So what are the drugs which can cause seizure? This is another important cause. So guys, I request all of you to please write me in the chat box, what are the drugs, guys, which can cause seizures? Hanji, can you please tell me what are the drugs which can cause seizures? I am waiting for 1 minute to get your answers in the chat box. Yes, guys. Nanu, Dopapa, Nitpal, Ayan, Akash. Yes. Sparkle Shine, what is well? No, beta, I am not asking anti-epileptic drugs. I am asking the seizures which can precipitate or which can cause seizures. My question is this. So drugs that can cause seizures are why I am going to discuss the drugs, because these drugs they can ask you in a single one-liner, or they can frame out some history where there will be a use of this drug, and they will give you history of seizure or the clinical features of seizures, and they may ask you which of the following is the likely cause, right? So you should be smart enough to recall these drugs. First of all, alkylating agents like busulfan, chlorambucil, right? Then we do have antimicrobial drugs or antiviral drugs, particularly that of quinolones. particularly that of quinolones. In quinolones, they may ask you like particularly levofloxacin, ciprofloxacin, right? Now, this levofloxacin, ciprofloxacin, they are commonly used in India for any kind of infection, particularly that of a respiratory infection. So when you are going to encounter a question of a seizure and you find that the patient had some respiratory symptom, some drug was given in the initial stages, and after that drug patient is presenting to you with some seizure, so the likely cause can be this loans, depending on what kind of quinolone they have given. Then some other drugs like antiviral drugs, like I'm writing over here, the third one is like acyclovir, right? Even anti-tubercular drug isoniazid, right? So these are the drugs. Then some drug withdrawal. Another important question is drug withdrawal can also cause seizure, or it can precipitate seizure. So can you please tell me guys which drug I am talking? Which drug I am talking? Now that drug is consumed in the evening most of the time in India or worldwide. Hanji, that is a drug. Basically, that is a drug. That is another thing that it is widely and openly available everywhere. What thing I am asking about? And after consumption of that drug, some people they get very emotional. Some people they get very aggressive. Yes, Dr. Naruto, it is absolutely right. It is alcohol. So guys, do remember this thing. I just made a funny way so that you can recall over here the withdrawal of the alcohol. And when you are going to recall, please do remember I'm writing over here on a side over here, not a part of the Caesar. But you have to, important question you can mark is alcohol withdrawal. Alcohol withdrawal signs you have to understand very. So when you are going to revise the thing we have discussed earlier also, so please do remember to call the signs of or the symptoms of alcohol withdrawal. This is very important. Then alcohol withdrawal is one thing, right? Then withdrawal of sleep inducers like zolpidem, right? Zolpidem, barbiturates, benzodiazepines, benzodiazepines. So this is the important list of seizures. Okay. So guys, I think we have discussed about the different type of seizures. We have discussed about the clinical part of the seizures, clinical, what do you call it as the clinical features of the seizures. So I'm just going to discuss about the what do you call it as the anti-epileptic drugs. Straightway, this is the important point which I am going to talk about, the anti-epileptic or the anti-seizure drugs. That is very important, right? So if they ask you what do you call it as a treatment, right? So treatment can be divided into the first line treatment and the alternative treatment. So treatment, first of all, if they ask you the treatment for generalized tonic-clonic seizures, GTCS, right? For GTCS, my dear friend, the first line treatment is going to be the two drugs. What are these two drugs? We have to give lamotrigine. We have to give lamotrigine and valproic acid. And valproic acid, it is the treatment, right? Alternative treatment, we can go for drugs like phenytoin, we can go carbamazepine, right? We can go levetiracetam, levetiracetam, right? So this was about GTCS. Another is focal seizures. For focal seizures, right? The first line treatment is going to be what, beta? It is lamotrigine. We can choose lamotrigine. We can choose carbamazepine. We can choose carbamazepine, phenytoin, right? Levetiracetam. It is levetiracetam, right? So these are the first line. Then alternative drugs we can choose is valporic acid. We can choose what, beta? Valporic acid, zonisamide, and zonisamide, right? Then we do have absence seizures. Absence seizures, right? In absence seizures, what we can choose, my dear friend, is ethosuximide, right? We can choose lamotrigine. We can choose valporic acid, So these are all these drugs are what, beta? These are the first line drugs. These are the first line drugs for absence seizures. Alternative drugs we can choose are is what, beta? Hanji, clonazepam, one is clonazepam, levetiracetam, and levetiracetam. These are the two alternative drugs for absence seizures. Then the third option of the third type of seizures is myoclonic seizure, right? And in myoclonic seizure, what is the first line drugs? Hanji, the first line drugs. Can you please tell me the first line drugs? So the first line drug we can choose is valporic acid, right? Then is lamotrigine, and the alternative drugs we can choose is what, beta? It is clonazepam, right? So these are some of the alternative drugs. So guys, quickly revise this thing, then we can proceed further. Okay. Anything which is not clear till now? So this is just a quick revision of the important points of the important topics which are highly expected. Do remember this thing. Why I have now? You have, when you are going to revise pharmacology, do remember this thing, that you have to revise, that side effect of each and every anti-epileptic drug. Guys, just a second. Let me put that on a mute mode. Just me. Okay. So guys, this was all about the important topic of the seizure, right? Then there is a thing which is called as status epilepticus. This is also important. Status epilepticus, right? Now, what is this status epilepticus? Do remember this thing: a seizure which is continued. Seizure continued. If a seizure continues for how much minutes? 15 to 30 minutes. The important line is this thing, those, that kitni der ke liye seizure, for how much long, for how longer. It is going to be for a 15-20 minute. A seizure is going to be a continuous type of seizure. I am just going to skip for the treatment part straightway. What treatment you have to give? So obviously you have to give the anti-epileptic drugs, plus now my dear friend you have to give IV benzodiazepines. Benzodiazepines. Benzodiazepine you have to give. Either you can give midazolam, you can give midazolam, you can give lorazepam. Do remember this thing. Do remember this thing. They may ask you a question upon lorazepam. Why I am lighting it? Because one, there are two things. Particularly, it is used in alcoholic patients. It is used in alcoholic patients. Secondly, it is long acting as compared to this, long acting. It is long acting. So one, you have to give lorazepam, midazolam, right? Even you can give diazepam, right? So you can also give diazepam, diazepam. Plus, my dear friend, you have to give anti-epileptic drugs, anti-epileptic drugs, right? This is very important. So you have given anti-epileptic drugs, IV benzodiazepines, right? Then if all this doesn't works, if all this doesn't works, do remember, if in the question it is written, if it doesn't work or doesn't gives any of a satisfactory result, patient is not able to sedate properly, then my dear friend, what you are going to do? Obviously, then you are going to give IV propofol. You can give generalized anesthesia, or not IV propofol, but yes, IV propofol can be used also. No harm in using, but then we will go for a generalized anesthesia. Generalized anesthesia you can give, right? And then go for mechanical ventilation. And go for mechanical ventilation. Go. Right. Okay, so we are done with this thing, right? Any question, anything which is not clear of seizures, please do ask me. I am waiting for here for 1 minute, right? Then we can proceed with the next topic. So guys, any queries, any questions, please do write me in the chat box. Okay, so the next important topic which we are going to discuss is about meningitis. The next important topic which we are going to discuss is meningitis. The next important topic which we are going to discuss is about the meningitis, right? So what is meningitis? Just a quick revision of the definition. It is the infection of the CNS, right? Or let's say it is the acute purulent infection within the subarachnoid spaces, or just simple you can remember that it is the CNS infection. Now this CNS infection, it can lead to, first of all, do remember it is CNS infection. Just the important points we are going to discuss over here. This CNS infection can lead to three things. Mainly, the first of all, there will be a decreased level of consciousness. Decreased level of consciousness. Decreased level of consciousness. Patient can have seizures, right? And third, patient can have increase in intracranial pressure. Patient can have increase in the intracranial pressures, right? Now, why I have chosen this topic? Because here again the causes are very age specific. What are the causes? So guys, if I ask you that what is the most common cause in a neonates, Hanji, can you please tell me what is the most common cause in a neonate? I am waiting for your replies. If they ask you a simple line question, what is the most common cause of seizures in a neonates? I am waiting for your replies. So guys, do remember this thing. The most common cause of seizures in neonates are going to be one, it can be Listeria monocytogenes. It can be Listeria monocytogenes. It can be Listeria monocytogenes. Apart from this, group B streptococcus can be the cause. Group B streptococcus can be the cause, right? So do remember this thing. The simple line they can ask you is this thing, Listeria monocytogenes or group B streptococcus. These are the two important causes, right? So these are the two important causes. Do remember this thing. And if they ask you another important thing, that age specific I am talking about, if a patient comes to you with the age group of 2 months to 12 years, oh sorry, 12 months, 2 months to 12 months, means the infant age. If they are asking you a infant age, what is the most common cause? Hanji, can you please tell me? Again, it is going to be Neisseria meningitis. It is going to be the Neisseria meningitis, right? Then my dear friend, the third one comes age between, what do you call it as age? What age? They can ask you is age somewhere between 11 to 18 years. Guys, just a second. Neisseria meningitis is going to not be the cause over here. Please correct it. Right? It is going to be the H influenza. H influenza. H influenza is going to be the cause over here. From 11 to 18 years, my dear friend, please correct it. 2 months to 12 years, H influenza is the most common cause, right? Then Neisseria meningitis is basically Neisseria meningitis. Is the most common cause between 11 to 18 years. Then the fourth important cause is what, beta? Most common cause of in adults of meningitis, it is going to be Streptococcus pneumoniae. It is going to be what, beta? It is going to be the Streptococcus pneumoniae. It is going to be the cause, right? Then the fifth cause is age of more than 50 years What is the cause? Most common cause in an age of 50 years. It can be due to some infections because of group B streptococci, and the important cause, guys, is CVA, cerebrovascular accident, is going to be an important cause. So do remember this thing, guys, that these are the important causes, because these causes can be asked, from a microbiology point of view, from medicine point of view. They can ask in pediatrics as well as in medicine also. So do remember this thing, right? Okay, so let's lead to the question. Next thing they can ask you is what beta. Obviously, just orally, I'm just going to explain you the clinical features. Okay, we can write even what are the clinical features quickly. Let's revise about the clinical feature. So you may find three things very common over here. One, you may find that the patient is having fever. Patient can have headache. Headache. Patient can have neck rigidity or stiffness. So these are the three important features of a patient presenting to you with a meningitis. Apart from this, you can have a Brodinski sign positive, or you can have a Kerning sign positive. Kerning's sign positive. So these are the two positive over here, right? So these are basically the meningeal signs which are going to be positive. Then patient can have increased ICP, intracranial pressure is going to be increased in some of these patients presenting with the meningitis. How you are going to say this patient is having this? If the patient presents with a acute severe headache, right? Patient will have neck stiffness, right? Then patient can have papillary edema, very important. Patient will have papillary edema, patient will have nausea, patient will have vomiting, right? This important thing which I'm going to write is the important thing, so I'm just going to write it in red color. Patient will have a Cushing's reflex. Patient will have what beta? Cushing reflex. So can you please tell me what is Cushing reflex? Hanji, can you please tell me in the chat box that what does Cushing reflex means? So I am waiting for 30 seconds over here just to know from you what is Cushing reflex. So guys, yes, Cushing reflex is what beta? It is hypertension with bradycardia. It is hypertension with bradycardia. So they are not going to use the term hypertension with bradycardia. Rather, they will be going to give you, some kind of blood pressure, increase in the blood pressure, and they will show you a lower heart rate, and then you should be smart enough to pick it up that they are talking about the Cushing reflex. If Cushing reflex is there, think of an increase in intracranial pressure. So please, guys, put a star mark over here. Then apart from this, patient can have irregular respiration. Irregular respiration. Patient can have a nerve palsy, right? And another feature, patient can also present with seizures. So seizures is the presentation also for a case of what beta? Seizure can also present in a case of meningitis, right? So guys, another important thing about meningitis, how you are going to do the investigation. So let's quickly remember, I'm just going to tell you upon the camera screen that first of all you have to do the clinical examination. After clinical examination, immediately take the blood culture. Do remember this thing, or just quickly write down in a sequence manner. They can ask you, first of all you have to do the clinical examination, then after clinical examination immediately take the blood culture. preferred that you have to take the blood culture from the two different sides. If it is in the option, then check for whether papillary edema is present or not. Papillary edema is present or not. If it is present and if it is not present, if it is negative, if it is present, don't do lumbar puncture, don't do LP or don't do CSF examination. If it is negative, go for a lumbar puncture. Reason behind this thing, if the papillary edema is present and you insert the needle in the spine, there will be chances that there will herniation can occur, right? So to prevent the herniation in papillary edema present, we have to we don't have to do the lumbar puncture. Do remember this thing, right? Okay, if papillary edema is not present, yes, you are going to do the lumbar puncture and you have to go for a CSF analysis. You are going to do a CSF analysis, right? Another thing, after obtaining the blood culture, what immediate step you have to go for? You have to, one step you have gone for to check the papillary edema. Second step, you are going to give IV antibiotics, empirical antibiotics. You have to give IV antibiotics, plus you have to give the steroids. So these are the two steps you have to immediately follow after doing a blood culture, right? Now once you have done with the CNS CSF examination, based upon the CSF examination, what finding you are going to find? Finding which you are going to find in bacterial meningitis, right? So in bacterial meningitis, what are the CSF examination you are going to find? Hanji. So first of all, you may going to find an increase in the polymorphoneutrophils, increase in PMN cells, particularly that of leukocytes. Leukocytosis can be there, right? Particularly you may find more than 100 cells per milliliter, right? Second, you will find that there is a decrease in the glucose. You may find that there is a decrease in the glucose. How much decrease? Less than 40 milligram per deciliter. Because do remember, we are talking about what? We are talking about bacteria. So the bacteria is engulfing this glucose, right? Then the third thing you are going to find, that you are going to find increase in the proteins. Right? Another important feature, you may find that there is an increase in the opening pressure of the CSF. So you may find an increase in opening pressure of CSF. How much opening pressure? More than 180 centimeter of water. Do remember this picture. I am writing centimeter of water. It is not millimeter of mercury. It is 180 centimeter of water. This can come to you as a single one-liner MCQ or in a clinical based question also, right? So these are the finding of what beta? These are the finding of bacterial meningitis. Now let's talk about the findings of a viral meningitis. Findings what you are going to find in viral meningitis. Findings you are going to find on a viral meningitis, right? So the first important finding you are going to find in a viral meningitis is, yes, that there will be a pleocytosis. There can be a pleocytosis. There can be increase in the proteins. Yes, now this is very important. Glucose is going to be normal. Glucose, what beta? Do remember this thing. Glucose is going to be normal, whereas in bacterial, glucose was increased, right? Then my dear friend, you may find a normal or mildly elevated. Opening pressure. Mildly elevated opening pressure of CSF. Mildly elevated, how much? You may find more than 100, 110, 120, but as comparatively to the bacterial infection, it was more than 180. So in normal or in routine cases, you may find a normal opening pressure. But yes, in some cases, the pressure can be just approximately more than 100, 110, 120, approximately like this thing. The important feature over here, that the total cells are going to be 25 to 500, 25 to 500 milliliter. And there in bacterial meningitis, do remember this thing. What did we find over here? Here we find the leukocytosis over here, right? Total cells, we are finding that predominantly, what we are going to find, predominantly lymphocytes will be present. Lymphocytes are going to be present over here. Lymphocytes are going to be present over here. Okay, so they may ask you the treatment. So quickly revise the treatment part, guys. Treatment part. First of all, see, in Harrison it is clear written for bacterial meningitis. BM, I am just writing bacterial meningitis. They have mentioned penicillin G. Penicillin G, right? But we know this penicillin is not available in the market openly. So what drugs, other drugs which we are going to use, we can choose is ceftriaxone. We can choose ceftriaxone. We can choose cefotaxime. We can choose cefotaxime, right? We can choose vancomycin. Vancomycin, right? We can choose neficillin. We can choose is neficillin. We can choose ampicillin plus sulbactam. Ampicillin plus sulbactam combination. Depending upon the culture report, guys, or we can choose also gentamicin. Gentamicin. So this is for what, beta? This is all for bacterial meningitis. Do remember this thing, that penicillin G is in the option. If someone can get penicillin G, it's very good. Because of resistance, the government of India has gradually withdrawn this penicillin from the market. So it is a little tough to get this penicillin. So other drugs which we have is the list of these drugs, right? Then they may ask you the treatment for viral meningitis. VM, just a short form, viral meningitis. What we are going to give? First of all, we are going to give IV acyclovir antiviral. We are going to give IV acyclovir. We can give valacyclovir. We can give valacyclovir, right? You can give famiciclovir. Famiciclovir, right? And some more thing, guys. Obviously, we have to give steroids over here. In both the cases, yes, steroids, because I mentioned steroids in the earlier stage, so I just forgot to mention over here steroids over in viral and in bacterial, both we have to give. Yes, they may ask you another thing over here, that in a case where there the patient is immunocompromised, immunocompromised, what you are going to give, Haji. So here you have to give antiviral plus you have to give IV immunoglobulin, IG immunoglobulins you have to give, guys, right? Okay, so this was all about the meningitis. I am waiting for your replies over here in the chat box. If something is not clear, please do let me know, else we can proceed with the next topic. So guys, I hope the questions I am asking, and I am hoping the questions from you, anything which is not clear. Findings, what kind of findings, beta? Dr. Naruto, what kind of findings? The findings are going to be the same. The patient is going to present with fever, headache, neck rigidity, everything is there. If you think that the patient is having fungal, then you have to just add a antifungal drugs over there. Okay, so let's talk about the next topic. So the next topic we are going to talk about is stroke. Although stroke is going to be an important topic, I think we need to have a detailed lecture upon stroke. And we in the previous classes we had a detailed lecture of stroke also. So before your examination, I will request the backend team to please put some give us more time to have a discussion upon like ECG, like stroke. So let's say how they proceed for us. Anyhow, what is stroke, guys? First of all, put your pens down and understand the concept. If in the question you find that there is an acute onset of non-convulsive and focal neurological deficit, do remember this thing. If you find that the MCQ is telling you that the focal neurological deficit is going to be more than how much? 24 hours. Focal neurological deficit is going to be more than 24 hours. It is going to be a stroke. Means the signs and the symptoms are going to be a stroke. If the signs and symptoms they resolve within less than 24 hours, what it is going to be? It is going to be a transient ischemic attack. Do remember this thing. So transient ischemic attack. Now just a quick revision. I'm just going to revise the stroke within 5 minutes. So I'm just going to tell you the important points over here. Right. Now there are two type of strokes. There are two type of stroke. The first very important stroke is called as ischemic stroke. It is ischemic stroke, right? So the first very important topic it is called as ischemic stroke, or we call it as infarctive stroke. Approximately 85% of the patient they presents with this infarctive stroke or ischemic stroke. So this is the most common type. This is the most common type. Whereas my dear friend, hemorrhagic stroke. The second type is hemorrhagic stroke. Approximately 15% of the patients come with this thing. Right. Now, they may ask you directly what are the causes. What are the causes? They may ask you directly that what are the causes of ischemic stroke. I'm just writing ischemic stroke. So ischemic stroke, my dear friend, first the patient have a most common cause is cardiac causes. Now cardiac means beta what? Patient can have cardiac emboli. Emboli, this is going to be the most common cause, right? Now from where this emboli can rise? It can rise from left atrial thrombus. Left atrial thrombus. It can be due to the result of atrial fibrillation. So left atrial thrombulation, maybe it has arisen because of the atrial fibrillation, right? It can be due to a result of dilated cardiomyopathy. Because what happens in dilated cardiomyopathy, blood stays for a longer period in the ventricles, and if the blood stays for a longer period, chances of getting hypercoagulation or hypercoagulable blood, or the blood will get more thicker and chances of having clot formation will increase, and it can cause stroke. So dilated cardiomyopathy, right? Then mitral stenosis. Now, why mitral stenosis? Because the blood won't be able to shift properly from the atrium to the ventricle. Again, there can be a chances of blood clot, and that blood clot can travel into the vessels of the brain and can cause stroke, right? So this is the first most common cause is this cardiac causes. In this ischemic type of stroke, the second important cause is atherosclerosis. Second important cause is atherosclerosis. Atherosclerosis, and this can also form thrombus. This can also form thrombus, right? Okay. Then we do have other causes like vasculitis. vasculitis causes, right? In vasculitis, particularly that of patient SLE, scleroderma, SLE, scleroderma, Wagner's granulomatosis, right? Syphilis, right? Then hypercoagulable states, hypercoagulable states, right? Like patient can have, polycythemia vera, polycythemia vera, right? Sickle cell anemia, sickle cell anemia, right? Protein C and S deficiency, factor 5 Leiden deficiency, factor 5 Leiden deficiency, right? In recent, you can also mark COVID-19, that was also, a hypercoagulable state. That was also a hypercoagulable state, right? Then apart from this, guys, other causes include for ischemic stroke. Other causes, this is very important one-liner MCQ, or they can frame out in this causes they can ask you, is first of all pregnancy, oral contraceptive pills, right? Then is nephrotic syndrome. Then is nephrotic syndrome, right? Cocaine abuse, cocaine abuse, smoking. So these all are the causes, right? Do remember this thing, OCP use, cortical vein thrombosis. OCP question has been asked previously in your examination upon the on the OCP. So the answer was cortical vein thrombosis and the patient had thrombosis. Do remember this thing. Okay, ji. Right? So let's discuss about the some of the causes of hemorrhagic stroke. Hemorrhagic stroke causes. Causes of hemorrhagic stroke. So what are the causes of hemorrhagic stroke? The first very important cause is the most common cause of hemorrhagic stroke is the intraparenchymal bleed. Intraparenchymal bleed, IPB, I am just writing in the short form, intraparenchymal bleed, or it can be due to hypertension, it can be due to hypertension, or it can be due to arteriovenous malformation. It can be, yes, due to arteriovenous malformation also. It can be because of arteriovenous malformation. Second most common cause is what, beta? It is subarachnoid hemorrhage. It can be due to subarachnoid hemorrhage. Now this subarachnoid hemorrhage can be because of two reasons. One, it can be due to trauma. It can be due to trauma. Second, it can be due to rupture of berry aneurysm. So this is another cause, a rupture of berry aneurysm, right? Rupture of berry aneurysm, right? So this you have to remember this thing, right? Now they may ask you what is the one simple MCQ, most common vessel to be involved in the case of stroke. That is going to be the MCA territory, middle cerebral artery. MCA territory is going to be the most common vessel. Yes, do remember this thing, right? So I am just going to quickly, just within a 1 minute, just a quick revision about the clinical features if the MCA territory is insulted, or if there is thrombus or some blockage or infarct, or let's say if there is any kind of bleed. What I am saying, if the MCA territory is involved or occluded, so what is the clinical features, or what are the findings you are going to find in the case of stroke? So first of all, whatever the site of means, if the right is involved, then the left side hemiplegia is going to be there. So there is a contralateral hemiplegia. So first of all, there can be a contralateral hemiplegia. There can be a hemianesthesia. There can be a hemianesthesia, means ki there can be a sensory loss of face, arm and legs. Particularly remember, do remember this thing, sensory loss of face, arm and the legs. Patient can have hemianopia. Patient can have hemianopia. Patient can have dysarthria. Patient can have dysarthria. Patient can have global aphasia. Patient can have global aphasia. Patient can have dressing apraxia. Patient can have dressing apraxia. Patient can have anosognosia. Patient can have what beta? Anosognosia. So guys, there are lot many things which needs to be discussed, right? But because of we have lack of time, so I'm just going to stick with this thing only, right? So guys, do remember this thing, that this MCA territory, when you're going to revise, please do remember this thing. I'm just going to show you a picture how you have to do the clinical feature, what you call it as a radiological clinical feature you have to look of stroke. I do have a picture over here, right? So on the screen you can see that this is a picture of a ischemic stroke and a picture of what you call, so the area which is defined over here, this is area white. This area on CT scan you can find that it is bright white area, B for bright, B for blood. So blood means hemorrhage. Do remember this thing, it is hemorrhage over here. Whereas this area you can see over here, this area particularly, it is a dark shaded area. It is a cerebral infarction. It is what beta? It is a cerebral infarction. So the thumb rule is this thing, bright white area. B is for blood. Blood means hemorrhage beta. Dark shaded area means the patient had a ischemic stroke or infarctive stroke. So this is how you have to remember the thing, right? So I hope in a given time frame we have discussed a lot of things, right? Another thing which we want to discuss, I wanted to discuss a lot of things, but because we have a limit of time, so we'll see you in the next class. That's what I can say, right? And we can discuss whatever the topics you want to discuss. Just send me that list in the Unacademy app so that we can put the things accordingly. I hope you have enjoyed today's session. So keep on revising the thing. Take care. Thank you very much. Have a good day ahead. Thank you very much, guys.